Do you have pain or swelling on the inside of your knee? Or maybe pain when you rise from a sitting position? Then this video is for you. Hello and welcome. My name is Amanda and welcome to my TriPhysio YouTube channel. Today we're going to be talking about Pes Anserine Bursitis. That's a very fancy word to describe pain on the inside of your knee, just below your knee joint where your hamstring muscles attach onto your tibia. So before we get to the bursitis part, we're going to look at what the Pes Anserinus is. This is a fancy term to describe where three different muscles of your thigh join onto your knee. You have your sartorius muscle, which comes across from the outside of your knee and attaches there. You have your gracilis muscle, which attaches all the way from your groin down your thigh onto your knee. And you have your semitendinosus muscle, which is part of your hamstring. And where these three muscles attach is what we call the Pes Anserinus tendon. Under the tendon, you have a bursa. Now, a bursa is a fluid-filled sac, which is there to create cushioning between where a tendon passes over a bone and on the bone itself. If you can imagine a tendon rubbing like this over a bone, you can imagine how much inflammation and irritation there would be without a cushioning in between. So a bursa is just there to reduce the friction between the tendon and the bone. However, when there is added compression through these tendons, it actually lands up squashing and irritating the bursa, and instead of the bone getting inflamed, the bursa gets inflamed, and this is what we call a bursitis. In this video, I'm going to give you a little bit more information about this bursitis in particular. We're then going to look at your treatment options, how you can tape to offload some of the pain, and what exercises you can do to actually fix the cause of this condition. The most important thing to understand is what these muscles that form this joint tendon actually do. The three of them all have slightly different functions, but when they're put together to form that Pes Anserinus tendon, what they do is flex your knee at your knee joint and they rotate your tibia, this shin bone, inwards. When we can understand the role of what these muscles do, we can understand how to add on or take off compression through that tendon. Women are often a lot more at risk of this condition than men because of their anatomical structure in having a wider pelvis. Having a wider pelvis means that the angle that your thighs run at is a lot steeper as opposed to men who have a more narrow pelvis. When your thigh runs at more of an angle, it places a lot more strain and compression on those inside thigh muscles that pass over that Pes Anserine bursa. So if you are overloading those muscles because of poor biomechanics or just because of a wider pelvis, like in women, you land up compressing that bursa and irritating it. Like we said at the start of the video, you might find that you have pain when you've been sitting for a long time and then you have to stand up, or sometimes when you go up and down steps. Sitting in a prolonged position with your knee flexed or your feet tucked under you means that the bursa is being compressed by these shortened muscles resting in this position for a prolonged period of time. If you're moving around more often, it just means that you can stretch those muscles and then let them go, and stretch them and let them go. So there's less active resting compression on your bursa. So what exactly are your treatment options? The first one for any bursitis is to take a good anti-inflammatory. I, as a physio, cannot advise what the best anti-inflammatory is to take. That's for you to ask the pharmacist. But it would be a good idea to take a solid course of anti-inflammatories to settle down that inflammatory process that is occurring in the bursa. Your next option is physio treatment to release the tension in the very tight and stiff muscles, to address the joint alignment and mechanics, and just to do an assessment of your overall biomechanics to see where the cause of your problem actually lies. Your pain in the meantime, on top of taking the anti-inflammatories, you can use K-taping. The therapeutic effect of the tape is to relax overused muscles. I'm not sure how many of you have seen, once you've taken the paper off the back of the tape, you'll notice there's a wave-like pattern on the tape. What this wave-like pattern does is it creates a lifting effect on your skin. So it offloads the very sensitive pain receptors and just creates a lot more breathing space. So those pain receptors aren't constantly stimulated and irritated. and it also creates more space for lymph drainage and for swelling to flow out and for new blood flow to enter the area that's actually needing to heal. What do the rehab exercises do? Like we said earlier, once you've had a really good assessment done, to be able to identify the actual cause behind the bursitis, you want to be able to address that cause through exercises and rehabilitation. These exercises will focus on improving mobility where there is a restriction in range of motion. It'll focus on improving muscle strength in the weaker muscle groups, and it will focus on your neuromuscular control. Neuromuscular control is just a very fancy way for explaining how your brain interprets all the different signals that get sent to it from the different joint receptors. It uses all these messages to calculate how you should move, when you should move, what muscles need to activate, and what muscles need to stop working in order to create perfect biomechanics. So you can't just do simple stretching and strengthening exercises. We actually want to teach your body how to control movement and how to balance and coordinate all the different muscle groups at the same time to produce perfect biomechanics. I'm now going to demonstrate a taping technique that you can use to offload your bursitis. This will just help with pain relief, and it might also help with the swelling that you have found in that area. I'm sure you would have noticed that there might be some puffiness just about 5 centimeters down off from your knee. By offloading this area with some tape, we can just create some space for that swelling to move up towards your lymph nodes in your groin. So to strap your Pes Anserine Bursa, I want you to cut small little strips of your K-taping, about that size. Remember to cut the corners off the edge of the tape. This just helps the tape to stick a little bit better. Also remember to prepare the site you're going to strap so that the strapping sticks. You just want to make sure you have no creams or oils on your skin. So once you've cut your 4 strips of about 8 centimeters each, you're going to tear the paper off the back of each of them. You just make the little tear in half. Make sure that you expose the area you're going to strap properly. And you're looking in this region. It's about 5 centimeters below your kneecap, just on the inside on top of your shin bone. If you have a proper Pes Anserine bursitis, you'll notice that there probably is a little bit of puffiness and swelling in that area, so that's exactly where you want to strap. You're going to pull the paper apart like that and give a nice 50 to 100% stretch in the middle of the tape. You're going to stretch it and put it down as you apply it to make sure that that area is like suctioning your skin up over your bursa. So you're going to do this with the 4 different pieces of tape to form a star shape, crisscrossing across each other. So you place your first layer down with a stretch, and your 2 anchors at the side are going to go down with no tension. You're just going to scrape those down. Then you do your next one perpendicular to the angle that you just put the last one down at. Then your next one, you're going to do it at a 45-degree angle to start completing that star shape. And your last one perpendicular to the one you have just placed down. Give a nice stretch in the middle and just make sure that your tape doesn't stick together, and you want no creases on your tape. This just increases the effectiveness of the tape. Give it a stretch, lay it down, put your anchors down, and we have a nice star shape. If you look closely in the middle of the star shape, sometimes you can notice almost a little bit of a puckering of the skin. This is a good sign. It just shows that that area of the bursa that you're wanting to lift up is being lifted up, and this is what takes pressure off those pain receptors and lowers your perception of the pain in your knee. So let's start your rehabilitation exercises. One of the main biomechanical factors that contributes to Pes Anserine bursitis is the fact that your thigh dips in when your glute medius muscle is not working properly. You'll often call people knock-kneed when you see this effect. It's just because your knees drop in so much that they're almost touching together. So we want to be able to train your glute med muscle to keep your femur, the long bone in your thigh, rotated and pulled outwards. These exercises are really nice and simple to do at home. You're not going to need much equipment to do it. All you will need is a foam roller and a TheraBand. So we're going to start with what we call clamshell exercises to strengthen your glute muscles. You're going to place the band around your knees. You're going to lie on your side with your hand on your hip and keeping yourself propped up, not slumping into your shoulder. Push your bum forward. You're going to lift your top knee up into the resistance of the band without rolling your pelvis backwards. Make sure that you've activated your core and that as you lift your knee, your pelvis stays stable. You should feel this pulling a lot in your glute muscle. Hold for 2 seconds and drop down. Obviously, depending on your individual strength, your number of sets and repetitions are going to vary. So if you feel this is too easy, you can work this up to 10. Have a bit of a break by doing it on the other side and then come back and you want to repeat 3 sets of this. If this starts becoming too easy and you want to progress the exercise, you can push yourself up into a half side pillar plank and you're going to repeat the same exercise. Not slumping into your shoulder, not rotating your pelvis. Keep your pelvis up and use your glute to pull your knee outwards. The next big biomechanical factor with regards to your Pes Anserine Bursitis is that your adductor muscles, the muscles that run from your groin down the inside of your thigh to attach to your knee, are often overactive and overloaded. This just means that your body uses them too often and too much, and as a result it compresses the bursa down below your knee. So we want to be able to lengthen these muscles. Yes, you can stretch them. Yes, you can foam roll them. We'll show you that later. But for now, I'm going to show you an exercise that actually lengthens this and produces a permanent change in length. This is just because of the way the exercise is done and how the muscle is used. It uses muscle strength as the muscle is lengthening. This we call an eccentric exercise. So I want you to find a nice open wall. You're going to place your feet up on the wall. Get yourself as close to the wall as you can. Place your feet up on the wall and very slowly you're going to lower one foot all the way down, working against gravity, dropping it down towards the floor. You want to try and keep your right pelvis down so that your whole body doesn't turn. You want to keep your pelvis down and allow a nice stretch down into your tendon. To come back up, bend, pull, and place back up. And you're going to slowly lower down like this over 10 seconds. Control the movement the whole way. Bend and pull back up. I'll show you one more repeat. Keep your hands on your hips to make sure they're stable and slowly lower all the way down. As we mentioned earlier, one of the muscles that joins onto your Pes Anserine tendon is your inside hamstring muscle called your semitendinosus. This muscle also gets overloaded when you have a Pes Anserine bursitis, and we also want to produce a permanent change in length of this muscle by doing an eccentric hamstring exercise. So this exercise we call the hamstring extender, and you need absolutely nothing to be able to do this exercise. You're going to lie on your back. Place your hands around your thigh, and to be able to bias the movement, as in to focus the movement more towards your inside hamstrings as opposed to your outside hamstrings, you want to twist or rotate your tibia inwards. So almost pull your foot inwards towards your other leg, and you're going to hold it in that position. While you hold that, you're going to keep your femur at 90 degrees to the ground, so perpendicular. This stays set. You don't move that position. You're only going to straighten your knee until you feel a pull on the inside of your hamstrings. just to a point where it's pulling and not hurting, and then you bring it back. Keeping your foot in the rotated position, you're going to continue doing this. And you might feel that you warm up and you're actually able to get further and further every time. And you're going to start with 3 sets of 7 repetitions of this. If you want to, after 1 set, if you're feeling like it's warmed up a bit, you can pull your femur a bit closer to you and repeat the same thing. And you obviously want to do this on both legs the whole time to make sure you balance out left and right. Something that is always crucial to any injury are your core muscles. If you have a lack of control above, you're going to have poor mobility and control below. So we want to make sure that your core muscles are holding your pelvis and your hips nice and strongly, that the control is good, as this takes a lot of compression and a lot of pressure off your lower limbs. So I'm going to give you one core exercise called the dying bug. This is a really good exercise to develop control as you allow your limbs, both your upper limbs and your lower limbs, to be moving. You want to focus on keeping your low back pushed onto the ground so that your back doesn't arch as they move. This requires a lot of control from your muscle we know as transversus abdominis. So you're going to lie on your back, hips to 90, knees to 90, and your hands in the air. Okay, you can start the exercise even just holding your arms there, and you're going to lower your foot down to touch the ground, alternating between left and right. Make sure that as you drop your knee, your back doesn't arch. Okay, you want to keep your back, your transversus abdominis firing so that it holds your low back onto the ground. And you're going to do alternating toe taps. If you want to add arms into this, you're going to alternate left leg with right arm, right leg with left arm. Making sure that you control the movement at your spine the whole time. If you do this properly, you should feel a nice deep burn in your lower abdominal area. Along with your physio treatment and the lengthening exercises that I'm giving you, a foam roller also helps to reduce the tension in the overused muscles. To be able to roll out the inside of your thigh, you can get a foam roller, any shape and size. You're going to lie with the leg you're rolling perpendicular to the rest of your body and place the foam roller perpendicular to that. Okay, you're going to use your right side and your elbows to roll yourself along the ball or the roller. You want to work all the way from your knee to the inside near your groin. And if you find any particularly tight or tender spot, you're going to hold it on that spot and bend and straighten your knee. And you'll feel a lot of pressure goes directly to that sore area. The next technique I'm going to show you is how to roll your hamstrings. This is a little bit hard, and sometimes it's nice just to get a ball to sit on the edge of a surface and put the ball under your hamstring and move your foot up and down. But if you're too sensitive to do that, you can give this a try. Sit with the foam roller under your hamstring, cross your other leg over, and you're just going to roll up and down on the foam roller. Remember to roll on the outside and to roll on the inside by rotating your leg. Roll all the way from behind your knee up to where your glute is and back. You can switch legs. You also need quite a large degree of core control to lift your body weight up and use a foam roller, so you're getting good bang for your buck with this exercise. So we're going to finish off with the exercises in standing. I want you to take your band, put it around your knees, and we're going to do band walks, focusing on the same control from your hips, pulling your knees outwards. You're just going to step side to side, pulling your knees out into the band, not allowing your knee to dip in with the resistance of the band. Similar exercise, I want you to find a wall. You're just going to slide down on the wall and you're going to hold in this position with your back flat on the wall, pulling your knees out into the band. And we're going to hold that for 20 seconds. You should feel it burning in your quads and in your glutes as you sit in that position. And then push back up. And you can repeat this 5 times. The last exercise is another exercise to lengthen your hamstring muscles. So I want you to find a surface where your feet will be able to slide quite easily, either a tiled surface with socks on, or on a carpeted surface with something slippery under your foot that you can slide. Find something that you can hold on to. And the hamstring that you're going to be lengthening is the leg that you're going to be standing on. So if we're going to be lengthening the right hamstring, I want you to stand on your right leg with your knee slightly unlocked. And you're going to slowly slide your left leg backwards and allow this hamstring to stretch out on the right. When you start feeling a stretch, hold on and pull yourself back up. And you're going to repeat this. Make sure that the degree of your right knee always stays at about 10 degrees. Shift your whole body weight back as your hips slide backwards with your left leg and pull forwards. Make sure you don't go too far back that you can't get your knee forward again. Just control the movement over 10 seconds, and as you feel that your extensibility and your flexibility is improving, you can slide that leg further and further out. I hope this video was useful. I hope this information you can apply to your injury, and I hope it puts you on the road to recovery soon. Please don't forget to hit the like button if you enjoyed this video and consider subscribing to my channel. Take care and see you soon.